Patient education. Hiatal hernia. What is a hiatal hernia? A hiatal hernia occurs when the stomach protrudes through an opening in the diaphragm into the chest. The diaphragm is a flat, muscular wall that separates the chest from the abdomen. In order to understand a hiatal hernia, we need to review the anatomy of the upper GI tract. The human esophagus or food pipe starts at the back of the throat, travels through the chest, and then across the diaphragm into the abdomen where it connects with the stomach. The connection between the esophagus and the stomach, also known as the gastroesophageal junction, is normally located several centimeters below the diaphragm in the abdomen. The esophagus comes across the diaphragm through a tunnel called the hiatus. The word hiatus literally means gap or opening. A hiatal hernia occurs when the stomach and gastroesophageal junctions slide back up through the hiatus of the diaphragm into the chest, where they normally do not belong. A hiatal hernia can be small, medium, or large-sized depending on how much of the stomach has protruded into the chest. What are the symptoms of a hiatal hernia? Most small hiatal hernias do not cause symptoms. Medium and large hiatal hernias can cause symptoms of gastroesophageal reflux disease, also known as GERD. These symptoms include heartburn, difficulty swallowing, pain in the chest or abdomen, regurgitation of food, acid reflux back up the esophagus, and sometimes nausea and vomiting. In addition, very large hiatal hernias can cause symptoms related to the large size of the stomach pushing against the lungs. This can result in difficulty with breathing and chest pain. How do you diagnose a hiatal hernia? A hiatal hernia is usually found during X-rays or tests that are being done to diagnose the cause of abdominal or chest symptoms or of symptoms like heartburn. Some of these tests include upper endoscopy or an X-ray of your digestive system, such as a CT scan or a contrast swallowing study. An upper endoscopy is a test where a specialist inserts a thin flexible camera down your esophagus and into your stomach, usually investigating the cause of some abdominal symptoms such as pain, vomiting, or heartburn. CT scans and contrast swallowing studies are special X-rays that can give detailed pictures of parts of the chest, abdomen, and gastrointestinal tract. How do you treat a hiatal hernia? Hiatal hernias that do not have any symptoms usually do not need any treatment. Hiatal hernias that are associated with symptoms of gastroesophageal reflux disease, or GERD, are usually treated with medications that alleviate the heartburn and reflux, also known as antacids and anti-reflux medication. Surgery may be needed when the symptoms of gastroesophageal reflux disease are not controlled well with medication. Surgery may also be needed if a very large hiatal hernia is causing respiratory symptoms because it is pushing on the lung. Sometimes emergency surgery is needed if the stomach that has come up into the chest becomes twisted and results in a blockage or a compromise of the blood flow to the stomach. How is surgery performed for hiatal hernia? Surgery for hiatal hernia is most commonly performed in a minimally invasive fashion. This involves making small cuts in the abdomen through which thin long instruments are placed and the surgery is performed. This is called laparoscopy. Sometimes the minimally invasive procedure can be performed using robotic surgery, in which the surgeon sits at a console and controls the instruments that perform the surgery. The surgery is performed under general anesthesia and can take 2 to 3 hours. In general, the surgery involves bringing the stomach down from the chest into the abdomen and then surgically recreating the gastroesophageal junction to prevent acid reflux. Minimally invasive surgery for hiatal hernia has the advantages of small incisions, improved pain control, shorter hospital stay, quicker return to work, and less complications as compared to surgery through a big open cut. What are the possible complications of hiatal hernia surgery? All surgery carries the risk of surgical bleeding, infection, and injury to internal organs, which are standard possibilities for most surgery. Long-term complications of hiatal hernia surgery specifically may include bloating, difficulty belching, difficulty swallowing, and possible recurrence or a return of the hiatal hernia or of the reflux. Other risks can occur from surgery and hiatal hernia surgery that should be discussed with your doctor. If you have been diagnosed with hiatal hernia, you should see your primary doctor, gastroenterologist, or a specialist surgeon for consultation on next steps.